CGTN, China Global Television Network.
COVID-19 vaccination campaigns have kicked off across the globe, and the rolling out of the vaccine is now raising hopes as well as fears about equitable distribution of the much-needed doses. As many developed economies continue to secure large numbers of vaccines, poorer nations risk being priced out of the market. However, the African Union has stepped in to secure about 270 million doses for its member states, many of whom are developing countries. But faced with much more infectious strains of the coronavirus and pre-existing challenges in health, infrastructure and manpower, time is of the essence for the continent in vaccine distribution. So this week on Talk Africa, we look into these emerging challenges in the COVID vaccine rollout in Africa and the progress the continent has made so far. I'm Beatrice Marshall. Welcome to Talk Africa. For months now, a team at the African Union has been working to ensure the continent is supplied with adequate quantities of the coveted COVID-19 vaccines. But questions remain on how soon that will be and the mechanisms of distribution. My colleague in Addis Ababa, Gerum Chala, sat down with Dr. John Kengasong, the director of the Africa Centers for Disease Control and Prevention. Take a listen.
Dr. John Kengasong, thank you so much for talking to CGTN. Now, what mechanisms have been set up at the continental level to acquire and distribute COVID-19 vaccinations, Doctor? Let's just begin with this.
With respect to the COVID-19 vaccine, we all know that we cannot end this pandemic without an effective and safe vaccine. A COVID vaccine are going to be the game changers. Now, having said that, the continent is working very, very hard to ensure that we have a safe and effective vaccine excuse me, in a timely fashion on the continent. We are working with three mechanisms. First of all, we are working with the COVAX facility in Geneva, which is an organization set up between the World Health Organization, Gavi, and CEPI. CEPI is a coalition for epidemic preparedness innovation. President Ramaphosa, in his capacity as the chair of the African Union, also established the African Vaccine Acquisition Task Team, abbreviated AVAC. And through that task team, you probably heard 2 weeks ago, he announced that the continent will receive 270 million doses of vaccines. And individual countries like Egypt, Morocco, Seychelles are already working with China to acquire vaccines. So those are three mechanisms that we are working to achieve vaccines for the continent.
Well, how far have these mechanisms that you've mentioned delivered on the role?
So I think the AVAC mechanism, which is the mechanism spearheaded by President Ramaphosa, will likely start vaccinating by March or April, starting with the Pfizer vaccines. As you know, in that mechanism, we have about 50 million doses of vaccines. We have started receiving orders from countries into the platform, that is the African Medical Supply Platform, that will enable quicker distribution of the vaccines across the continent. So I think we remain hopeful. Having said that, we are still working actively to explore how we can get earlier vaccines to start vaccinating our healthcare workers. We currently have about 3 million healthcare workers on the continent, and we believe that from a very strategic and tactical standpoint, it will be very important to vaccinate those people first, especially given that we are in the second wave of the pandemic, which is raging, and many people, the mortality is increasing. And so if we vaccinate them, then they provide them with safety for our frontline to respond to the pandemic.
Doctor, once acquired at the AU or perhaps continental level, what's the criteria for distribution of these vaccines? And how is the decision of who gets first and who waits? If it has already perhaps happened, please give us some specific examples that you have.
You know, our continent is unique. when you read the reports, they say, especially reports in the West, there's a narrative that we should vaccinate healthcare workers first, and then also the elderly, and then followed with people with underlying diseases. So that is okay, but with respect to Africa, we have challenges with that. First of all, in most countries in Africa, only about 3.5% of the population is more than 65 years old. So we don't have many people in that category. Second, with respect to underlying diseases, 4 in 5 people on the continent do not know that they are hypertensive. So it becomes difficult to prioritize that group of people, which means you have to screen people to understand that they are hypertensive, and then you vaccinate them. So from that perspective, we also have to understand that our epidemiology on the continent is different. Most of the infections are amongst people less than 60 years old, the young people. And the young people are also not asymptomatic. They are also asymptomatic. Most of them are infected, but they are not falling sick. But at the same time, because they provide that level of, that high level of asymptomatic, they become reservoir. Okay, it means they can transmit it without knowing that they are infected because they are moving around. And so it is very important that we have a strategy for vaccination that is contextualized in Africa. That is, we vaccinate, of course, the frontline workers, the healthcare workers, but also vaccinate the population, the young population, so that we can at least begin to create that herd immunity. Our target on the continent is to vaccinate up to 60% of our populations to achieve population immunity, or what is commonly called herd immunity.
What is the role of the African Union member states, if any, perhaps in enabling or supporting these vaccine acquisition mechanisms?
Yeah, there are certain countries on the continent that are already advanced. I mean, as I said earlier, Egypt, Morocco, Seychelles are working with the Chinese to get their vaccination program going. The rest of the countries are working very closely with us. Okay, in the spirit of what we are calling the whole of the continent approach. That way, no country is left behind. We believe that is the best way to navigate this, because acquiring vaccines, especially in this era where you have scarcity of vaccines, is very challenging, and no one country in Africa can successfully acquire the right doses. The best option would be to work through the African Union, Africa CDC vaccine approach, supplementing the COVAX facility as well. So I think it's a strong appeal that we work as a collective to acquire those vaccines for the continent.
Now let's talk about China, Doctor. In which way has China-Africa partnership and collaboration in fighting the pandemic enhanced access to an acquisition of the COVID-19 vaccinations?
So let me start first of all by recognizing the very important work that we work with China to achieve early on diagnostics through the Jack Ma Foundation, and it's really a special appreciation because it came at a point of a need. At that time, the continent was in dire need of diagnostics, and those early diagnostics and personal protective gears were extremely valuable to enable countries to prepare to fight the pandemic. I think that is very important to recognize. Now, with respect to vaccines, we are in discussions with both the government of China through their embassy here in Addis Ababa, in discussions with China CDC, and in discussions with the Chinese vaccine manufacturers. All what we are saying is that we are organized. We have an advisory group that can review vaccines on the continent and make a decision there. So it is really for the mutual interest of both the Chinese companies to work with us so that we can understand aspects related to the efficacy of the vaccines and the effectiveness of the safety of the vaccines. If we review those two aspects and we are comfortable with that, we as the Africa CDC will be in a position to recommend those vaccines to broader use on our continent.
Now, in terms of the continent-wide COVID-19 vaccination reach, what do you project for the first 6 months of the year?
We should approach, first of all, let me say this, that it is going to be a historic exercise to be able to vaccinate the continent at scale to achieve 60% herd immunity, which is a conservative number that we should absolutely strive to achieve quickly. So in the next 1 to 2 years, we should be able to achieve that level of vaccination in order to create that, to blunt and fight this pandemic. Without that level, the tendency is that the virus will become endemic on the continent, and we just don't want that to be the case. We don't want to be seen like the continent of COVID-19. COVID didn't start here, and we shouldn't remain on our continent there. I think that is one. Now, it's going to be a historic exercise because the continent has never, ever vaccinated more than 50 million people a year on the continent. The vaccines that you and I know are vaccines that are targeting a childhood immunization, and even for adults, it's not large-scale vaccinations. However, we are prepared to vaccinate. We need the resources to do the vaccination. We need partnerships to do the vaccination. So assuming that we have the vaccine, we have to focus on vaccination. That is 5 key things. Train healthcare workers in large numbers to vaccinate at scale. Second, put in vaccination centers, okay, so that you can roll them out. Thirdly, make sure we have good information system to track people, because if you remember, there are mostly 2 doses. That is, somebody received the first dose, after 4 weeks, you receive the second dose, so you need to track them so that there's not lost to follow up. And fourthly, the community. The community has to be extremely mobilized. We have to create what I call a vaccine literacy campaign so that the community is actively involved, understand what the vaccines are, and understand that this is for the interests of the individual and for the interests of the community. That we either go down together or we rise together. I think that is extremely important. Then lastly, the political leadership has to be up to the game. That is, mobilize the resources and build appropriate partnerships that will facilitate every process that I have outlined. If we do these things, then I'm very convinced that we are able to scale up vaccination in the next 2 years on the continent.
Dr. John, my final question. Vaccinations will change the game, absolutely, but are not going to give the immediate solution one desires. So what should member states of the African Union keep on doing in order to continue fighting the pandemic?
Absolutely. I think I have 3 messages for the member states and for the community. First of all, as you rightly said, vaccines are going to be the game changer, but it's not going to be the magic bullet, for sure. Remember, it takes a while for vaccines to work, and also vaccinating people to scale will take time. So that means that we have to continue to enhance the public health measures that we know how to do. As a matter of fact, we are better prepared today to fight the second wave of the pandemic, which is raging on the continent, than we were 1 year ago. 1 year ago, we didn't have diagnostics. We have very limited personal protective equipment. We didn't even know the virus, but we know all of this. 1 year ago, we peaked on the continent. That is, we're recording about 18 to 20,000 cases of the infection every day. And we fought that down. We brought down the curve to a level that we're only recording about 6,000 cases a day, which means we know how to fight the virus, okay? So if we apply those same skill sets, which is avoid gatherings, avoid closed-door events, make sure that we wear masks consistently. And on that point, I would really call on the governments on the continent to subsidize masks. They may seem cheap, but a vast number of our population cannot afford masks because you have to wear them only for about 4 hours, toss them away, and then bring in a fresh one. Government have to come in and support that. The community has to own the response and actually lead the response, because it has to be seen at the community level. That is one thing we must do. The second thing that we have to do is to make sure that at least we continue to respect the hand hygiene, okay, that is the washing of hands regularly all the time, so that we avoid touching our face, nostrils, eyes. We know that it works. We have seen how with those measures we were able to bend the curve extremely well during the first phase, and even during this second phase. Countries like Kenya have done extremely well. Okay, Kenya peaked around August, July, and then they had their second wave, and now they are one of those countries that have successfully, over the last 4 weeks or even 6 weeks, bend the curve down to a very, very acceptable level. So we know how to fight this virus, but we have to have that commitment. The last thing we have to do is really the political commitment has to be there. Not just political will, but political commitment. Look, this virus is damaging our economy. Damaging our economy. Very early on, when I flew into Addis Ababa and I saw all those Ethiopian airline planes standing on the tarmac there, it was heartbreaking. That is a huge economic impact. We know that the continent is going to face its recession, in the first recession in 25 years because of a virus. So I think the political commitment must be there, but the political will as well must be there to fight this pandemic.
Life moves pretty fast. Ideas move at the speed of sound. Technology moves at the speed of light. If you don't filter out the noise, you might miss the details. We pay attention to the details because they matter, showing you a different perspective. See the difference.
Let's now bring in our guests on the program. Joining us from Pretoria via Zoom, Dr. Angelique Coetzee, the chairperson of South Africa Medical Association. And joining me from Kampala via Zoom as well, Dr. Fiona Atuhebwe, the Africa Region New Vaccines Introduction Officer. Thank you both for joining in this discussion. Fiona, let me start off with you regarding this debate around vaccine distribution globally. I mean, since some countries began rolling out COVID-19 vaccines, wealthier countries have secured about 51% of the vaccines, even though they are home to about 40% of the world's population. Put this in context for us, as well as in terms of where the world is in global vaccine distribution.
Thank you very much, Beatrice. And yeah, as you mentioned, that is very true. And it's one of those heartbreaking things that we've seen in the recent past before the WHO Director General actually put out a cry talking about this inequality that we're seeing and inequities with the vaccine distribution. However, we are now seeing some results, and with a COVAX facility that was set up to improve the equitable distribution of vaccines for both, to include both the low and middle income countries and the high income countries. And this global solidarity that we thought would really, really work, and we're still very hopeful. We thought it had been a long darkness, but we are starting to see light at the end of the tunnel with the COVAX facility right now, looking at 2 billion, achieving the 2 billion doses by the end of 2021, and the possibility of actually going to 3 billion plus if all goes very well. And this should be able, as you know, to cover at least 20% of the African population, meaning that countries need to work a little more harder. But also, we know that the African Union recently made an announcement for the 270 million doses that they've secured.
Angelique, let's look at the situation of South Africa, because South Africa says it has so far secured about 20 million doses. It is hardest hit on the continent, but we do also understand that there's a new variant that has come out of South Africa that may be, not as effective with the current vaccines on display. What are South Africa's options, and is South Africa concerned about the new variant and its reaction to the vaccines?
Yeah, South Africa is extremely concerned about the mutations, especially of the new variant, the 501.V2 or variant 2, because there's 3 mutations that might give us problems, of which 2 of the mutations tends to escape our antibodies. So we're not sure whether these vaccines that's going to come in currently will neutralize enough of this 2 mutations. So that might be a problem. Also, we know that the current vaccines coming in has been developed before the V2 variant started to emerge. So going forward, we're still going to have to vaccinate. We are starting with the AstraZeneca one first, and we will be able to, for now, starting within the next 2 or 3 weeks with the rollout to vaccinate our healthcare workers, that's including doctors and nurses. And we have acquired enough vaccines for the healthcare workers for the first round. The second dosage would only need to be given 3 months from now on, and that again would buy us some time to get enough vaccines in for the second round to do. We also have decided to vaccinate in 3 phases. So the first phase is the healthcare workers. The second phase is your people who working with the public, like the police, the teachers, the elderly people in old age homes, and then people with non-communicable diseases, or people with chronic diseases. And then the third wave will be the more predominantly younger people, more healthier people, or even 50-year-old that is healthy and doesn't have any chronic disease.
What we are seeing in the debate of the haves and the have-nots, we are seeing some African countries taking the lead there. Now South Africa is beginning vaccination. The Seychelles, Egypt, Morocco have all begun vaccinating their populations. Rwanda is making headway towards that scenario. How is it that some countries, like those mentioned, are able to get ahead with the vaccinations while there are still many others that haven't even begun the process?
Well, I think the short answer, it lies on the political level. And remember that the manufacturers normally will only speak with the government of the day. So the negotiations will be through government to the vaccine manufacturers. So if it hasn't happened yet, you would need to ask the government of that country, why hasn't this not happened? Might be as well that there's a money issue, because you need to pay for the vaccines when they come into the country. You cannot say, I'll pay them off about on 3 or 4 months, please send it to my country. So you need to negotiate. And so again, or that maybe it can be that some of these African countries wait to get it through the COVAX vaccine program, which Fiona just described to us. Again, I'm not sure whether you will, in the end of the day, get it for free. If your country is one of the low-income countries, but they should start negotiating, because you cannot rely only on COVAX.
Fiona, are you seeing a lot of disparities in the various African countries in their distribution and their progress in getting the vaccines?
Yes, this has already been seen. So far, like we mentioned, only one low-income country, Guinea, in Africa, has gotten 25 doses. But we've seen countries like Seychelles. Seychelles on the 10th of January did launch a national program, though this was from a donation from the UAE with the Sinopharm vaccines from China. But also we can see that South Africa has also gone ahead to look for their own vaccines. This is a self-financing country. Mauritius has already announced the arrival of 100,000 doses of the AstraZeneca vaccine from the Serum Institute of India. So we see a disparity already between the low-income countries and the lower middle-income countries, even within Africa. But of course, we also see that with Europe and the US, we are seeing it's quite different when it comes to securing these vaccines.
I think Fiona raised a very important topic here by, the vials will come into the country. So you will get the vials, but you need to understand that the logistical rollout and the needles and the special syringes, especially with the Pfizer one, yeah, they need to be acquired. They're not going to come with all of that. They're not going to come with all the cold chain fridges and all of that. So you still need, as a country, to be able to fund your rollout and to get your healthcare workers to pay them, to get your facilities going up and running, to how to transport those vaccines in your country. You're not going to get that donated to you. You're going to get the vials donated to you. And all of those vials will have a cold chain, regardless what the temperature is. There will be a cold chain that needs to be kept. And I know that the AstraZeneca vaccine is also light sensitive. So it means you need to know what you are doing. You can't leave the vial out for 2 or 3 or 5 hours and it's extremely hot. It's 40 degrees out there, and then want to reuse it the next day. We need to be careful with all of this. So there's a logistical problem, and that is what is going to cost money.
All right. So to you both, ultimately, this is going to be a lesson in self-reliance. Part for the lower income countries, part of it will be funded, but a lot of it will have to be, domestic resources and governments finding ways to fund the full chain of the vaccine progress. So how do you see the continent, though, responding to future health crises? And what are the scenarios that you see emerging moving forward? Angelique, let's start off with you.
Sure. I think one of the most important things that needs now to be looked at is the manufacturing of vaccines on the continent itself, on Africa itself. We need to start setting those facilities, get them up and running, whether it is only for normal immunizations like measles and all of that. So we need to make sure that we start producing on our own continent these type of vaccines, because this is not going to end. Unfortunately, we also need to make people aware that even if you get the vaccine now, maybe in 6 or 8 months from now on, there will be a new variant. You will get a new vaccine that you need to take to stay healthy going forward. So we expect that the virus will have different mutations going forward in different variants that would need, very much like your flu vaccine, that you would need to take it on a regular basis going forward. So we need to start at some stage to produce our own vaccines on this continent.
All right. Fiona, your thoughts, what lessons have been learned so far and going into the future?
Yeah, so and Angelique spoke really well. We need to look into what we can do domestically and stop looking out there. If we did have actually our own manufacturing, we wouldn't be crying for doses right now. And Angelique, we are looking to South Africa with the Johnson & Johnson. We are keeping our fingers crossed that things will do work for us on the continent. And the lessons learned, really preparedness. We've prepared countries, we've had these discussions, but this is very unprecedented. Talking of a vaccine introduction when we do not have the vaccine in hand is very difficult. We can't start training health workers because we don't know what vial we'll get. Will it be the Pfizer -70? Will we get the AstraZeneca? Will we get the Moderna? So we've had lessons that just like the pandemic was unprecedented, that has hit us this badly, this has also been unprecedented. But we are learning that however much it is, we need to prepare. Just keep prepared. And the other thing we've learned is the infodemic that has come with the disease already, with the vaccine, before it even lands in our countries, people are already saying no and all kinds of wrong things and wrong information. So we've also learned to communicate and keep communicating and communicate and advocate with countries, advocate with funders, advocate with manufacturers, everybody out there, and the media, because you are now our voices and we rely on you and people take information from you. So there are so many lessons to draw from here, but having to prepare for a vaccine we can't see is not something that is easy at all.
All right, so Dr. Fiona Atuhebwe and Dr. Angelique Coetzee, to you both, thank you very much for this discussion. And that's all we have time for on this edition of Talk Africa. A big thank you to our panel of experts in Pretoria, Dr. Angelique Coetzee, Chairperson, South Africa Medical Association, and in Kampala, Dr. Fiona Atuhebwe, Africa Region New Vaccines Introduction Officer at the World Health Organization. Remember, you can be a part of this conversation online through Facebook, Twitter, and YouTube. And to join us again next week for more Talk Africa. From me, Beatrice Marshall. Until next time, goodbye.